Well, you raise that issue of money, and of course that is a concern, isn't it? Because if let's say we've seen a patient 20 times, that's probably grossly exaggerating any normal course of treatment, but they haven't got better, but they've spent 50 quid per treatment on us, and they decide to get grumpy about that. It's going to be very hard to justify it if we can't show that there's some evidence behind the approach we've taken.
Yeah, we have evidence around, if you look at osteopathy or chiropractic, now we are at a level of evidence where we have meta-analysis of good quality. We have quite a few of poor quality, but I'm thinking about one from, again, sorry about the mispronunciation, Bagagiolo, I think the name is Italian, woman, who did a systematic review, not a meta-analysis, that was published in the BMJ Open probably a couple of years ago. So if people want to find that, they should find it with that. And they looked at, I think it's a systematic review of systematic review. So that's the sort of level where we are at now. There are still lots of gaps, things we don't really understand around gynae, abdominal pain, headaches is a bit better, MSK, we're getting there. So, we have some evidence. So if one had to justify why they did, that sort of treatment for shoulder pain or whatever, we can have some evidence to suggest, it wasn't completely, unevidenced or lacking any form of evidence to do any of that. But you're right, there are forms of treatment being delivered currently for conditions for which there is really nothing at all. And I'm not for a cancelling culture in any way. I'm not saying that people shouldn't be doing any of that, but I do think they should have an open conversation with the patient saying, we have no evidence about it. I've seen patients with your condition in the past, and they seem to have responded well. It's a little bit unclear whether you will be responding. We don't know who responds, who doesn't respond. I would suggest, if you're happy with that, maybe we try for a couple of treatments and we review then. If we see no improvement, then we stop, and then you don't end up in these sort of 20 sessions of non-effective treatment and then leading to a complaint against you or these sort of things.